Hi guys, I will now present my case. A patient is admitted to your unit with severe diarrhea. The physician orders stool samples and stool cultures for microscopic examination of ova and parasites. In addition to a history of patient symptoms, discuss what other questions you would ask this patient. What is diarrhea? Diarrhea is an increase in frequency of bowel movements. However, the frequency of a regular bowel movement may differ per person, so it is important to know what is your regular bowel movement. Going back to the case, diarrhea is characterized by a discharge of watery loose stools. The severity of diarrhea is determined by the size and the number of stools passed within a period of time. There are three levels of severity of diarrhea. Mild, which means having few diarrhea stools in a day. Moderate, having more than a few but not more than 10 diarrhea stools in a day. And lastly, severe, which our given patient has. It is characterized by having more than 10 loose watery stools in 24 hours. The risk for severe diarrhea is high since it is accompanied by dehydration, which the nurse should look out for. What other question I could ask this patient? When did it start? How many times did you defecate or have your bowel movement? This is to confirm the severity of the diarrhea. Any recent travel? You need to ask this because the patient may travel to a place where diarrhea is prevalent or the drinking water is contaminated. Are you on nasogastric tube feeding? Nasogastric tube feeding may cause diarrhea if the formula or the equipment itself is contaminated. The use of dietary agents such as sorbitol can also affect the bowel movements. Do you have any food intolerance? There are foods that may trigger intestinal nerve fibers that leads to an increase in peristalsis. Classic example of this is lactose intolerance, since lactose increases osmotic pressure and draw fluid into the intestinal lumen. What was the last meal or drink that you took before the diarrhea started? There may be ingredients to the meal that the patient is allergic or intolerant, or the meal and drink are contaminated. How was the meal prepared? In relation with the previous question, the patient needs to recall how was his meal prepared because it might be the cause of his condition. Improper handling of food and not maintaining its temperature may cause bacterial growth that may lead to food poisoning or diarrhea. Do you have a change of eating pattern recently? You may also get the dietary history of the patient to let you assess further if this factor contributes to patient's condition. A change in eating pattern can lead to change in intestinal function that can cause diarrhea. What are your current stressors? This question may seem not related, but we also need to look at the psychological factors that may affect the patient because there are certain individuals that respond to stress with hyperactivity of the gastrointestinal tract. You have a history of gastrointestinal surgery. Diarrhea is normal 1 to 3 weeks after bowel resection. You may also ask here if the patient has a history of gastrointestinal disease since it can cause chronic diarrhea. Any history of abdominal radiation? Abdominal radiation can slough off the intestinal mucosa, thus decreasing usual absorption capacity. Ask discreetly about the patient's sexual history. Anal sex can cause proctitis, and one of the signs of this is diarrhea. Document the patient's answers to the question. So that's all. Thank you for watching, and I hope you learned something from this video.